Did you know that nearly 10 to 20% of known pregnancies end in miscarriage? The emotional impact is profound, but what does it really mean for the body? Today, we're diving deep into what in your body during a miscarriage. It's a topic that isn't often discussed, but understanding it can help many during a troubling time. By the end of this video, you'll have a clearer picture of the physical changes and emotional responses involved. First, let's talk about what a miscarriage is. A miscarriage is when a pregnancy ends on its own within the first 20 weeks. The loss can feel sudden and unexpected for many. Next, let's explore what happens in the body during this process. The first thing to understand is hormone levels. When a pregnancy starts, levels of hormones like progesterone and human chorionic gonadotropin, HCG, rise. These hormones support the pregnancy and its development. However, during a miscarriage, these hormone levels can drop quickly, which signals the body that it is no longer carrying a pregnancy. This drop can lead to various physical symptoms. Some common signs include cramping and bleeding. Cramping occurs as the uterus contracts to expel the pregnancy tissue. For many women, this can feel like a very intense period pain. The bleeding can vary greatly. Some may experience light spotting, while others might have heavier bleeding that can last several days. It's also essential to recognize that this process can be different for everyone. While some may handle it pretty straightforwardly, others might find the physical symptoms overwhelming. Now, what about the physical aftermath after a miscarriage? After the miscarriage, the body needs time to heal. It's normal for bleeding to last a bit, as the body clears out anything left in the uterus. During this period, women often experience emotional highs and lows. This is completely normal. Many women will go through feelings of sadness, anger, or confusion. It's a process similar to grieving. Talking about these feelings can be very important. Sharing experiences with friends, family, or support groups can help. There's also the question of when to try to conceive again. Doctors usually recommend waiting a little while, around 1 to 3 cycles, for physical and emotional recovery. This waiting period can feel challenging. The desire to get pregnant again might be strong. But it's crucial to listen to your body and how you're feeling emotionally. Now, let's address a common question: what can cause a miscarriage? While many factors can contribute, often there's nothing that could be done to prevent it. Common causes include chromosomal irregularities, hormonal imbalances, or health conditions that affect the woman. This fact alone reminds us of how intricate and delicate the process of pregnancy is. It's a sensitive subject, and there can often be feelings of blame or guilt. But remember, most miscarriages aren't anyone's fault. It's important to be kind to yourself during this time. If you're someone who's experienced this, know that you're not alone. Many women have been through it, and it can help to share those experiences with one another. As we wrap up the body's response, let's quickly touch on the emotional aspect again. Allow yourself to grieve the loss in your way. There's no right or wrong way to handle it. Some might find comfort in journaling, while others may want to discuss it openly with loved ones. Each approach is valid.